Hello, and welcome to the Functional Nurse Academy podcast. This is your host, Melissa Schreibfetter, owner and founder of the Functional Nurse Academy. Welcome, everyone. So today's show is going to be a little different because I absolutely must cover this Dr. Fauci debacle on my show. I have talked about frequently before how I launched the Functional Nurse Academy actually came about from the debacle of what went on during COVID. And I've said before that during COVID, I basically saw evil right in my face. What the healthcare industry was doing was evil. When we have individuals who are sick and suffering and we deny them treatment that is efficacious, that also has an excellent safety profile. And instead, the healthcare community was offering treatments that were very high risk, especially in regards to causing renal dysfunction, like the use of remdesivir, a very costly treatment that was part of the hospital protocols that was actually making the patient outcomes worse, but the hospitals were recommending this, were pushing it because they were being financially incentivized by our government to do so. We also saw so many things that don't make sense. You do not need to have a medical degree to understand that it is nonsense to expect a toddler to wear a mask. We also know that for a virus that essentially is low risk for healthy populations, why in the world would health organizations mandate an experimental mRNA lipid nanoparticle COVID injection to those individuals? And again, that would have never happened. Those vaccines, in quotations, would have never been emergency use authorized if there was a safe and effective treatment available. Thus, this is what happened with all of the suppression of things like hydroxychloroquine and ivermectin. And during this whole situation, and then it really was like living in the twilight zone when COVID happened, because I saw so many healthcare professionals that I once respected that abandoned any critical thinking and any logic to just blindly follow these bogus, unscientific, harmful guidelines. And then we even saw that people that were just devout followers of Dr. Fauci and what our public health agencies were saying then became aggressive and were attacking the healthcare professionals that were speaking out about the vaccine safety issues and about effective treatment. I even at one point had a nurse tell me that I didn't deserve to be a nurse if I didn't get my COVID vaccine. So many of us that turns out were on the right side of history were being insulted and ostracized. I also know of many nurses who were speaking out against these things and then got essentially what were phony reports to their board of nursing. So anyway, with all of this that happened, before COVID, I was not, very politically active or anything like that. But being a Christian, being very firm in my faith, when you're a Christian, and the word Christian means little Christ. It means follower of Christ. When you see evil, you do not just put your head down and go along with it. And you don't just put your head down and not say anything. So I decided to take the risk and get loud about these things. And when I started speaking out at events about early treatment, about the risks of the vaccines, I started to gain some traction and, I was able to network with other good people that were in this movement. And I already had this skill of functional medicine. I had launched a successful business. And then when these god awful, ridiculous, stupid vaccine mandates rolled out and so many nurses were losing their jobs. That really is what led to me launching the Functional Nurse Academy, because we knew that patients were being mistreated in the system. I actually, during COVID, I was doing free advocacy calls, because what was happening were individuals who were at high risk for COVID were presenting to the ER saying that they were having difficulty breathing, and they were being sent home and given instruction that, well, if your breathing gets worse, then come back. So no talk about any type of early treatment or any type of nutraceuticals, even though we know good and well that the individuals that were being admitted to critical care units had a tendency to be low in vitamin D. We knew good and well that hydroxychloroquine and ivermectin were effective as early treatments. I have been on the phone with grown men that were infected with COVID, that were on the phone crying, telling me that they were scared that they were going to pass away. And there were so many of us nurses that may not have had prescriptive authorities that really stepped in during that time as advocates to help these individuals get connected with a physician who has a backbone and a soul and was actually willing to do the right thing and to treat these individuals. Because during this time, say that someone, it really is truly high risk, and they had a COVID infection and they were having difficulty, just for them to try to get connected with a medical provider that would treat them. That information was so heavily censored. And because of voices such as Dr. Fauci, who was the leading voice in this, who was making public statements about how there was no safety studies, there were no legitimate studies showing that ivermectin and hydroxychloroquine were effective, because he was lying about that. Our health organizations followed that lead. And we also now know that he played a role in all of this censorship. There are so many Americans that, if they received proper treatment, would still be here. There are so many Americans that were pressured into getting a dangerous experimental COVID vaccination, that experienced severe injury and are still, to this day, being gaslit. And there are individuals that passed away after receiving those vaccines. So I really wanted to do a show today to talk about Dr. Fauci's subpoena and his diary, because again, I really, I'm very grateful that he is getting exposed. So a lot of people have been asking, how in the world did Senator Rand Paul get Dr. Fauci's diary? And what is so surprising to me about this is, so Dr. Fauci meticulously made all of these diary entries during the pandemic, which again, his diary entries contradict what he was saying to the public. But anyway, this man has such poor judgment that he was documenting his entries on a government system that was then thankfully retrieved by HHS. On July 29th, Dr. Fauci was actually subpoenaed to testify before the U.S. Senate Homeland Security and Government Affairs Committee, which was chaired by Senator Rand Paul. And this hearing focused on the federal COVID-19 response, the origins of COVID-19, gain of function research, vaccine mandates, and safety concerns in regards to the COVID vaccination, as well as the suppression of early treatment. And Dr. Fauci decided that he was going to invoke his Fifth Amendment right over 100 times, okay? So after the hearing, Senator Rand Paul actually announced that he intended to pursue a contempt of Congress referral, arguing that Fauci improperly refused to answer questions despite receiving a presidential pardon. That pardon went back to 2014, by the way. And so I do want to start out just by playing a clip that just shows an excellent review, very short review of what went on during the Senate committee. Now, I'm going to link this in the show notes because this was a compilation of different clips that was actually put on by the Highwire, which is an organization that actually accurately provided coverage during COVID. They were actually right about a lot of things. And because they mentioned things that we know now, that even the origins of the lab, Dr. Fauci was dishonest about. So anyway, this organization ended up losing their platform because they were saying that this was a lab leak. But I'm going to go ahead and just play that for you all real quick.
1 million Americans died from COVID-19. Some estimate as many as 15 million people died worldwide. Anthony Fauci promoted the theory that the virus arose naturally, while privately, he was well aware of a mountain of evidence suggesting the virus originated in the lab. Dangerous research was funded by NIAID in a totalitarian country, in a lab that lacked acceptable safety standards. The COVID lockdown could never have been inflicted without you aiding and abetting the crime. I hope today Dr. Fauci will come clean.
This hearing appears to be a culmination of months of biased and selected efforts by the majority under the guise of a committee investigation to basically legitimize a predetermined conclusion that was reached years ago. One-sided investigations designed to validate predetermined conclusions do not serve the American people.
Given Senator Paul's obvious obsession with calling for my prosecution, his repeated slanderous comments about me, his publicly releasing my unredacted personal diary aimed at embarrassing and intimidating me, the only conclusion I can reach is that the sole reason he is calling me before this committee is to get me to say something, anything, that could vindicate his repeated public pledges that I end up, in his words, quote, behind bars, unquote. Therefore, under the advice of my attorneys, I will invoke my right under the Fifth Amendment of the Constitution to refrain from answering your questions.
The Trump administration has launched a baseless set of smears against vaccines that help pull us out of that public health crisis. And it has used a politicized Department of Justice to target the researchers who helped us crack and understand the novel virus. Today's hearing is another page in that playbook, sadly, tragically.
These attacks upon Dr. Fauci, it's not just about him. It's sending signals to others who are thinking about serving our country, our scientists, our doctors, our healthcare professionals, our researchers. Trying to show to them that if you don't get in line with the politics, that you will also potentially be subject to attacks.
I certainly understand why you needed a pardon.
I certainly understand why, on the advice of counsel, you're not answering any questions, because I think it'd be almost impossible for you to answer the questions truthfully without really demonstrating what you did.
The haphazard information you released and pushed on the American people with little research is appalling, and why there's so much distrust in our institutions today. That trust is crucial to public health, and you, more than any person or event in my lifetime, have destroyed that trust for millions of Americans.
Clearly, what you think today is that somehow you're above reproach. You may have had a 50-plus year legacy of public service, but it ends in total and complete disgrace.
This is the pardon you have heard so much about. This pardon goes back to, and if you'll see, January the 1st of 2014. Did you talk to President Biden and ask for this pardon?
On the advice of counsel, I respectfully decline to answer based upon my rights under the Fifth Amendment to the Constitution.
Did you specifically ask that it be dated back to the beginning of 2014?
On the advice of counsel, I respectfully decline to answer based upon my rights under the Fifth Amendment to the Constitution.
I'm just very interested why it was this date. Did it have anything to do with the fact that 2014 was also the year that the NIAID or NIH began funding EcoHealth Alliance's Understanding the Risk of Bat Coronavirus Emergence Grant?
On the advice of counsel, I respectfully decline to answer based upon my rights under the Fifth Amendment to the Constitution.
Somewhere along the line, it became all about you. You became a narcissist and a megalomaniac and a liar. And you've lied to the American people, and you've lied to this body. And you've disgraced your profession by doing it. You called yourself the most famous scientist in the world. You've done more to harm science than anybody in my lifetime. And I hope you'll go home and write that in your diary.
On the advice of counsel, I respectfully decline to answer based upon my rights under the Fifth Amendment to the Constitution.
Well, nothing says honesty like taking the fifth, huh, Doc?
So again, there are so many things that are just absolutely stunning about this situation. And there are many things that really stand out to me that have really come out in these omissions in his diary. Something specific is that about 6 months after he publicly received the Moderna vaccine, he writes in his diary about how he had a pulmonary infarction, which again, that is a blood clot in the lungs. Now, that is a serious known adverse reaction to the COVID vaccines. And after that happened, he was completely quiet about that to the public. Now, again, this was Dr. Fauci. So he got the most top-notch available medical treatment for this in the country. But despite suffering a severe adverse reaction to this vaccine, he continued to repeat that it is safe and effective. And he continued to support giving this vaccination to vulnerable populations, such as pregnant women, such as infants. And I want to speak to this because this is something I am very passionate about, is supporting the vaccine injured. And this is one of the reasons why when I started Functional Nurse Academy, I decided that we were going to start donating a portion of each enrollment to help provide medical funds for those individuals that are injured from these vaccinations. And we have been supporting a wonderful organization called React 19, founded by Brianne Dressen, who herself was severely injured by a Pfizer vaccine. She was actually injured in the trial. But to this day, the government still is not recognizing these vaccine injuries. So these individuals are still getting gaslit in the system, and they're not getting the help that they need. And something else, because again, I was a very loud voice about how dangerous these vaccines are. And There was a study published back in 2021, and this was a study published in Israel, and it was showing for adolescent boys ages 12 to 16 that their risk of having a cardiac adverse event from the vaccines were actually higher than their risk of being hospitalized from the infection. And I want to mention that there are many adverse reactions to these vaccinations. And that was just the cardiac adverse events were more likely than them being hospitalized from the virus. There's just so much evidence that this vaccination is very high risk, especially when you were looking at individuals who are not high risk from the virus anyway. Why in the world would you take that risk? It doesn't make any sense. And I also want to speak about a couple of other things because, this whole situation, I see these things happen. And again, if you know anything about history, then you know that listening to the government is not how you get healthy. We know that individuals who have gotten a lot of power, a lot of wealth, tend to misuse that. And, we can see throughout his diary entries how obsessed that he was becoming with the fame and the attention and the power. And I also wanted to mention something else. I really do think that this whole situation, I think that this is spiritual. And I think the root of so many of these issues is the love of money. Now, we know that organizations within our government, such as the NIH, can hold patents on medical products, especially things like vaccines. And when there's money at play, people will do very, very evil things. And in 1 Timothy, verse 6 through 10, it says, "For the love of money is the root of all evil, which while some coveted after, they have erred from the faith and pierced themselves with many sorrows." Matthew 6:24, "No one can serve two masters. You cannot serve God and money." And something else that, when I wanted to cover this show also from a biblical perspective, because no one can tell me that Jesus is not real and that evil is not real. It was in my face. I saw it. And Ephesians 6:12 tells us that our present battle is not against other people. "For we do not wrestle against flesh and blood, but against the rulers, against the authorities, against the cosmic powers over this present darkness, against the spiritual forces of evil in the heavenly places." And when I did this, when I wanted to do this show, I think it's really important to cover. And again, I am bothered by what this man has done. I think that what has happened is incredibly evil. So, the humanity part of me wants to really do this show and lash out at this individual for being so ridiculously evil. But then I also want to understand this from a biblical perspective. And I really think that there are weak individuals in this world. They do not have a connection with God, and we're spiritual beings. What happens when you don't have any type of connection with God? You tend to make other things your God. And that can be money, that can be power, that can also be yourself. And to be honest, I do not think that this man is going to face legal repercussions, but I do think that if he does not repent for what he has done, I think that he will face eternal judgment. I was surprised to read that he had a pulmonary infarction because when the shots rolled out and there were all of these publicized situations of these major health officials, our politicians getting their COVID vaccines on air at that time, I did not think that those people were actually going and getting the experimental vaccine. So I was wrong about that. But I think that they're so incredibly deceived and their souls are so tainted with sin that their brains just don't think right. It's almost like your brain is seared. Psalm 7:15-16. He makes a pit, digging it out, and falls into the hole that he has made. His mischief returns upon his own head, and on his own skull his violence descends. And I'm seeing so much of this, these evil individuals that they were pushing these experimental vaccines because they have some type of financial interest. But then themselves, they're so incredibly deceived that they're also becoming injured from these products. Something else I want to bring attention to, because we should all be concerned about vulnerable populations, such as pregnant women, children, the disabled, babies that are in the womb, individuals that cannot consent to receiving an experimental mRNA lipid nanoparticle product. And something also that I think is so insane about this entire issue is that it just takes a simple research, maybe 2 minutes of research, to learn that lipid nanoparticles, one of the functions that they've been used for in the past is actually to deliver medication to the brain because they were able to bypass the blood-brain barrier. We also knew from Pfizer's own pharmacokinetic study that the lipid nanoparticles, they do not just stay in the deltoid muscle like our government organizations falsely claimed. They actually biodistribute all over the body, including the heart, the kidneys, the reproductive organs, the brain, the liver, and so on. And this is highly concerning that pregnant women were recommended by their OBs to take this product. So we're about halfway through the show. We need to cut to break, but when we get back, I'm going to show you another clip that is really telling about the just lack of safety and these real concerns about administering these products to pregnant women. If you are a fed up nurse and you want to leave the sick care model, I absolutely have a solution for you. At the Functional Nurse Academy, we are the leading and the most comprehensive functional nurse training program on the market. All of our graduates receive 90 nursing CEs. They are eligible for multiple board certifications in functional medicine and holistic nursing, and they also get business tools, resources, and live monthly mentorship that I personally teach each month. So if you'd like to learn more about that, check out my next free informational webinar, which is in the show notes. And also check out functionalnurseacademy.com. I do want to pause for a moment to remind our listeners. This show is also syndicated on America Out Loud Talk Radio, on the Nurses Report radio show and podcast. So you can also find me there on any major app. Hello and welcome back. I know that I am hosting a show today that is probably going to make everyone's blood boil, but so many of these lies are getting exposed. And yes, I am absolutely covering the Fauci diary today. And all of these things that are really coming to light. And I want to show you all another clip, which also is from the High Wire. I'm going to link this in the show notes, but this is from their investigative journalist. His name is Jeffrey Jackson, and he covered a really, really important topic about the lack of safety for COVID vaccines in regards to pregnant women. So we're going to take a look at that.
mRNA technology that allowed Pfizer and Moderna to make this vaccine that went into the arms of so many people around the world. He writes to Tony Fauci in February of 2021, this conversation. He said, Tony, I wanted to alert you to some new data we generated with our nucleoside modified mRNA LNP. That's a lipid nanoparticle. I attached the current version of a supplement request that has all the new data. He says, I'm working with a maternal fetal researcher, and we observed that using a dose 100-fold higher than current vaccines and given IV, the mRNA LNPs go to the placenta and the fetus, measured by translation of the mRNA, and cause an immune response in the amniotic fluid. If you're a woman and you're pregnant, an immune response to the baby that you're having will cause a miscarriage. This is science 101. You do not want an immune response to your own body. Yeah. Continuing, Drew Weissman says to Tony Fauci, in non-pregnant female mice, the uterus and ovaries take up mRNA lipid nanoparticles and translate the mRNA. We're repeating these studies with human dose levels of this LNPs given intramuscularly and are waiting to release the findings until these studies are completed. Tony writes right back, same day. He says, Drew, thanks for sending this. Looks like you have touched all the bases of informing people of your results. It'd be interesting to see what human doses levels given intramuscularly do. I hope that all is well. Not, holy cow, we got to go back to the board. We got to talk to the CDC. Who are you talking to about this? I need to see the studies right now. I'm flying there. Stop everything. Not Tony Fauci. Tony Fauci does not do any of that. And in fact, Drew Weissman then writes him back less than a month later. He gets the results back from these intramuscular human trials and says this. This is on March 1st, 2021. Tony, here is the human dose intramuscular studies in pregnant mice. We still have some concerns over the data, and we are talking to all the appropriate people. We still have concerns. We still have concerns. 1 month later,
wait, read that next line because it came up yesterday. All the prizes. Just go back. Congratulations, by the way, on the Dan David Prize, which everyone was talking about, the megalomaniac there. That was where he was focused. Now, to forget everything I just said here, probably just said, oh, thank you for the congratulations. I'm winning prizes. Not like, Houston, it looks like we have a problem with pregnancy. Continue. Sorry for interrupting.
Yeah, that email is a microcosm into this push-pull of narcissism and red alert science. And he's choosing awards, narcissism, all of that. So 1 month after Drew Weissman, the Nobel Prize winner for mRNA lipid nanoparticle technology, says, we have a problem. Our technology is going to the fetus in mice studies, going to the placenta, is causing an immune response. Tony Fauci goes out and they begin, CDC, FDA, everyone green lights this shot for pregnant women. Here's Tony Fauci at that exact time he wrote this in his diary. Take a look.
The next is the question of the vaccination of children, namely pediatrics and pregnant women. As we all know, these were not included in the original clinical trials that led to the EUA for the 2 vaccines that are currently available. But I want to point out that since the EUA and under the EUA, approximately 20,000 pregnant women have been vaccinated with no red flags, as we say, and this is being monitored by the CDC and the FDA.
Wow. I mean, there are people that compare him to, Mengele and others. They certainly were not as good at the publicity tour because apparently half of this country or the world maybe even considers this guy a hero.
I just don't know how an individual can be so incredibly lost. Now, how individuals treat vulnerable populations is very showing of their character. And what those diary entries and those emails and what he was telling the public is basically that he was well aware that the lipid nanoparticles from these vaccines, they were entering the fetus and the placenta and causing an immune response. And knowing that information, he still continued to recommend that pregnant women get these vaccines. And there also is plenty of evidence now that pregnant women that were getting these vaccines were higher risk for miscarriages. And there is also evidence that vaccinated women were having dysfunctions with their placenta. And since the rollout of these vaccines, there are states across the country that are reporting a higher rate of stillbirths. This is really sad. And again, I'm just not surprised by this, because another thing that came out during the Senate hearing was some of the disgusting biomedical research that Dr. Fauci was funding. So specifically, Dr. Fauci provided a grant funding hundreds of thousands of dollars. And do you know what they did research on? They took an aborted fetus, and they used that skin tissue from the aborted fetus to create humanized mice and rats. The scalp tissue from the aborted fetus was then grafted onto rodents, where it remained viable and grew human hair. How disgusting is that? So how can we possibly think an individual that believes that this is an appropriate use of government funds and research, why then would we trust an individual that is funding such heinous, disgusting, evil research to then make appropriate guidance to pregnant women? And again, something else that was mentioned several times in his diaries is, during COVID, and there were so many things that are really being exposed, because, he was saying things like he wasn't responsible for the shutdowns that was really coming from the CDC. But then, of course, in his diary, he was actually writing about how he was convincing governors and mayors to shut down their states. And during this entire time, it was just so non-scientific, because throughout this time, we saw that Sweden stayed open. We saw that Florida was opening up. It was very easy for us to look at health outcomes. And we actually saw worse outcomes in those states that were closed, because we had children that had learning delays. There were higher rates of substance abuse. There were higher rates of suicide. I mean, there's so much disaster from this. And another thing, the fame seeking. I mean, he wrote in his diary so many times about how he may have been the most famous doctor in the world. He had pictures of how people had decorated things like donuts with his name on it, and how people were wearing t-shirts with his name on it, and how people were making Fauci bobbleheads. And you would think that the country the world is having a pandemic, and you are one of the leading voices, but somehow you just have the time to be on the cover of all of these magazines, and you just have the time to go on Julia Roberts' podcast, and you have the time to go meet with celebrities and have private dinners with journalists. And, it really seemed like he was really enjoying this power and fame. And, you would think that it's just interesting that he had time for all of this publicity, but he just didn't have time to listen to the physicians around the country, around the globe, that were successfully treating COVID infections. And then those same courageous physicians were the ones that then were speaking out against the vaccines and treating those that were vaccine injured. Now, I also do want to play another clip from the Senate hearing. And this clip is in regards to the Nobel Prize winning medication ivermectin, which we know has traditionally been used for parasitic infections. Now, at the time of COVID, the FDA and the media, they of course were smearing this medication, saying that it was horse paste, but we know that medications that we have for humans, it's not uncommon to have medications also for use in animals. And we know 1/4 of prescribed medications in the US are actually prescribed off-label. And ivermectin does have very powerful antiviral properties, and the efficacy when you initiate it for early treatment is astounding. Now, I also want to mention, so at this time when he was lying about how there were no studies saying that ivermectin was effective, at that time, there also were studies that were being designed to make ivermectin look like a failed treatment. And this is a formula that people that have conflicts of interest will do. They will take something that may be a competing route of treatment to a route of treatment that is preferred because it's very costly, and they will purposely design the trial to fail. So sometimes they will either purposefully underdose the medication, or they will start the medication too late, or they will minimize the duration, and then they will publish those results and say, oh, look, it's ineffective. But then if you look at the results, it's like, well, why in the world are you using it in a way that is not used in effective treatment protocols? But anyway, this is another clip here. Now, this is Senator Ron Johnson, and he has really been such an advocate for the vaccine injured. He's been an advocate for early treatment, and he has been just horrendously smeared by legacy media for this.
There was a website that was tracking the random controlled studies. Here they are, showing 60, 70% efficacy of ivermectin. The same day you say there's no evidence, there was all kinds of evidence. Loved ones had to go to hospitals, had to sue hospitals. Just, would you try it? So I would want to know, to what extent were you involved in sabotaging hydroxychloroquine, ivermectin, and did you do that because you knew the only way you get an emergency use authorization for these drugs, these experimental gene therapy, was if there was no effective treatment, you couldn't get the emergency use authorization. So is that why you helped sabotage these cheap generic drugs in favor of remdesivir, which, by the way, nurses, are you aware of the fact that nurses called it run, death is near?
On the advice of counsel, I respectfully decline to answer based upon my rights under the Fifth Amendment.
So that clip there, so I couldn't find this part of it, but during the subpoena, they actually played a clip of Dr. Fauci around that time stating that there was no evidence that ivermectin was effective in the treatment of COVID. So anyway, I really don't want to focus too much on the negative, but I did want to do this show because I just really think that it is worth exposing this as much as possible, because this is how we move forward. We have to recognize these wrongdoings, and we have to understand that people that are in positions of power, they tend to abuse that power. We cannot suspend our critical thinking, our logic, our rationality, because there is a so-called expert telling us that we need to follow the science. And I am a firm believer that this happened, and so many people went along with it because we got away from God. We have got to get right with God. There are so many nurses in the workforce. We are the largest healthcare profession. Approximately 5 million nurses in the workforce. So many of us knew that this was nonsense. And we actually have the numbers. We have the numbers. We could have shut this down. My intention is not to shame anyone because maybe they were deceived. Maybe they didn't use proper judgment, but we must recognize these wrongdoings. We cannot let something like this happen again because you know what? History tends to repeat itself. Now, just like when I started to become aware that things that I learned about in nursing school were not correct, like all of the things I was told about vaccinations, I didn't understand that vaccinations at the time were using things like thimerosal containing adjuvants, aluminum adjuvants. I didn't understand the deficits in many of the vaccine trials and that many of them are lacking placebo safety testing. I didn't understand those things, but I understand those things now. And I did have to personally go back and I had to repent for those things because I was being deceived. It's my responsibility that I was deceived. So I had to repent for just going along with things and not using my discernment. And thankfully, when COVID came through, when COVID happened, I was already skeptical of the medical system. But what happened during COVID was so incredibly absurd. And I just know of so many people that they knew it was absurd, but they went along with it because they just didn't want to bother with the conflict. And now, even today, even with these Fauci diary entries that are being published and that are widely available, I am still seeing people dig their heels in and defend this man. And you know what? I think that this is happening because I think that there are people out there, they cannot admit that they're wrong. And you're not going to progress if you cannot admit when you are wrong about something. Sometimes we need to recognize that. We need to own it. We need to say that we're sorry and then move forward so we don't continue to get deceived. But anyway, moving on, I do think that I'm in the position that I am now because of this horrible situation. And I do believe that God is going to use the nurses to help to restore some level of trust in an alternative healthcare model. I do not think that this current healthcare model is going to be fixable the way that it is. There's way too much industry capture. Even the educational institutions are captured. One too many physicians and other nurses and healthcare professionals. They're employees of larger hospital systems that are also captured. So I really believe that we can have progress leaving those large industries, working on setting up concierge services that are outside of the system. And another thing that we're seeing is that people are becoming aware of the corruption of insurance companies. And we are seeing more programs like Christian health shares or crowd funds. And there are other programs that are out there that individuals can utilize for their healthcare spending that are outside of the system and actually want their members to heal and are receptive to holistic and functional medicine modalities. So I really think that there is hope out there. And again, with this whole situation, if you are a person that prays, I really just think that we need to be praying that justice will be served. We should be praying that these individuals, these wrongdoers, will come to repentance and find God. And also, if you know someone who is still deceived, who is involved in all of the false idolatry that comes along with the mainstream healthcare system, they need our prayers. I think that is the best thing that we can do for them. So I will be putting these resources in the show notes for you all. Thank you for tuning in. And I do want to remind our listeners here at the Nurses Report, we are here 5 days per week at 10 a.m. Eastern Standard Time. So be sure that you tune in to listen to our other wonderful nurse hosts throughout the week. And until next time, be safe, be well, and God bless. That is all the time that we have today. Thank you so much for tuning in. And again, if you want to learn more about the Functional Nurse Academy, please feel free to register for our next live webinar, and you will see that link in the show notes. You can also check out Functional Nurse Academy on our social media platforms or on our website at functionalnurseacademy.com. Until next time, be safe, be well, and God bless.